Dr. Jules, you
Hi.
are
Hi,
welcome to the hot
welcome.
sheet.
Welcome.
So you are the real life Dr. Robby in the pit.
Not
You're
exactly,
the
but there's a,
real
a lot
version.
of parallels.
But we wanted to talk to you because the show is amazing. It's such a hit. It just won a few Emmys. And they've gotten a lot of praise for being accurately representing the medical community. And so we thought it would be fun, since we're nonfiction people, to talk to the real deal
Yeah.
medical director.
No, I'm excited to be here. I love the show. I thought they did a fantastic job. It's been really exciting for emergency medicine. So I'm super excited to talk to you guys.
So is it like buzz in the community? Like
Yeah,
everyone wants to watch the pit?
well, for sure. And even more so. So we just had our ACEP National Conference, Scientific Assembly, that was in Salt Lake City. It's
What's
been
ASAP? What's the ASAP?
American College of Emergency Physicians. So it's kind of our home base for advocacy, for education, for board prep, job searches, sometimes political things that we need to get into. We need representation. That's our avenue. So we have an annual summit where we get together and you can do networking and recruitment and continuing education. So they have all kinds of classes and courses, and sort of everyone from the nation. It's actually international now. Come and meet in this
Wow.
one specific spot. And the really fun thing for this year was a couple of the directors and Noel himself were our guest speakers for a panel for our opening session.
Wow.
So it was
Wow.
really cool.
Did you
Did
get
you
to
get a
meet him?
picture?
I didn't get to meet him. I have plenty of pictures and plenty of videos. One of the videos I was looking back at today, I loved. So he went on a speech about how he did this 30 years ago with ER and how it invigorated a community to do what we do and go into emergency medicine and into this specialty. And he thought that it was really exciting for the ability to do that and have that representation. And now the dream is to do it again with a new generation and to bring back some of that excitement and that spark for emergency medicine. And in the video, there's like one girl that's like, woohoo! And that was me. So I'm the woohoo girl when he says that it's all about trying to continue appreciating our specialty. And the whole crowd erupted in applause. It was a pretty magical time.
Wow.
That's great.
I
Yeah.
love how entertainment can transcend into these communities and inspire real life professions. That's really neat.
I think that the part why this is done so well is because it was such a good representation. They talk about some of the political aspects that have been toiling emergency departments a lot since post-COVID. They talk about dynamics of different disciplines, some of the procedures we do, and even just like the idea of residency training. So starting out as an intern and then a PG, he says R1, R2 a lot, like resident year 2, resident year 3. But we use PGY, which is postgraduate year. So you finish from medical school, you take all of your boards, you apply for a residency program, whatever specialty you want. So I did emergency medicine at Einstein in Philly. You
Yeah.
3 to 4 years of that program, you graduate, then you sit for your boards. And then after you pass your emergency medicine boards, then you're the attending or Dr. Robby in this case. So I'm actually pretty elder. I've been out for 10 years now. So
And that's
I'm not the newest one on the block, which seems weird because I feel like I still feel and hope that I look young. So like I don't want to look around and be like, how am I the most tenured person here? But that's what's been happening.
and the
Wow.
strongest, by the way.
I did get asked the other day if I was the strongest doctor in Delaware. And
Oh,
I contemplated it and I was like, yeah, maybe. Yeah, it could
yes.
be. I'm not sure.
You should say yes, because how much do you, what are your numbers? How much do you deadlift, back squat,
Um,
bench?
so I'm coming back. I am 10 months postpartum. So I have a beautiful 10-month-old baby boy named Jackson. And then I had knee surgery in January. So what we're like 9 months past that. This week I did a 305 bottoms up pause deadlift for 3. So like you get just below the knee, hold it there for a couple seconds, and then pull it the rest of the way. So it's
Mhm.
definitely harder than your conventional deadlift. And then I did a 250 squat for 3. And then bench, I was doing 135 for 4. So pretty decent numbers.
Wow, yeah, that's great. That's great.
I'm going to compete again in November. I'm hoping, because I'm a master now, because I'm 40. So I'm hoping to take over some Delaware state records. I've had 8 previously, just in different weight classes and for different lifts. And then now that I'm entering this new division, I'm hoping to rewrite some new state records and maybe qualify for nationals.
Yeah,
Great, great.
powerlifting champ. You get strongest doc. I'm sorry. You
Maybe
are the strongest doc.
I'm open to challenges if people no. If people want to challenge me.
Hey, I used to have push-up contests
Oh
on my
yeah,
shoots. I would have
yeah.
my team like, "Well, how many push-ups can you do?" And I'd make everybody do
We
push-ups or
we
squats or
did something
something.
like that. It was probably 2 months ago. So one of my third year residents, his name's Vishal, but he actually talks about he remembers my interview with him, and I had on a dress kind of similar, and he was like, "Her arms are jacked." Was like what he kept thinking during the interview. But last week or a couple months ago, he said, "Let's go do a push-up regimen outside." And he didn't tell me what it was. And he brought me, one of our security guys, and one guy from environmental services who are like in shape. And so we did this like push-up contest, and I was the only one that didn't give up. Like I completed it. So I think when we did it, it was like you had to do a 7-second hold, and then you did one, and then you made your way up to 7 push-ups, and then you held that for a minute, and then you made your way back down. So you held in a plank position, and then you did 7 push-ups, and then you held it for 7 seconds. Then you did 6 push-ups, held it for 7 seconds. And this whole big, I don't know, 3-minute circuit.
Wow.
But I made it through.
Hey, I love it.
It's tough.
If you're gonna work on me, if you're gonna, put my arm back together or something,
We had
I
to
wanna
do
know
a
that you're fit. I wanna know
we
that you're
yep,
healthy and fit.
had to do a prosthetic hip dislocation reduction yesterday.
Ooh.
That definitely
Wow.
takes some strength. So, but we got it,
Oh,
no problem.
wow, that's
Wow.
interesting. So, did you watch ER growing up and get inspired and say, "I wanna be a doctor"?
No, so to be honest, it actually is just a little bit like too elder for me. So I missed it probably by like 5 years. I remember seeing like reruns, but it wasn't like my initial inspo. I don't know where emergency medicine inspired me. I always knew I was going to go into medicine. So my mom is a nurse, and I was very much around medical personnel. And at a really young age, I like got in my head I was going to be a doctor. And my mom at the time even encouraged me to consider nursing as my career. So I did that. I did nursing and pre-med combined. I actually worked as a nurse in the ER, actually at Penn State, Mount Nittany. And then I went back to med school and decided Dr. Jules is what it needed to be. And I have no regrets.
That's really cool. That's a lot of work. It's a ton
Yeah.
of work.
I think it's a lot of like jumping through hoops too. Like there's a lot of people that have like the baseline intelligence to do it. But it takes a ton of heart and dedication. And it's like, what are you willing to sacrifice to get to that point? And like, even still now, like I worked all weekend, right? So like I didn't get to be with my family. I do every other holiday. Like we do nights and weekends, and we go in the middle of COVID when no one else is working or wants to do anything. So there's like a level of sacrifice. And if you're willing to make that and you have that baseline intelligence, you can do it. It's just really how much grit do you have?
And as far as like at the ER, like you never know what's coming in the door, right? I mean, like how do you have to train differently, say, than another doctor? Like
Oh, yeah. Well, that's why you do your emergency medicine residency, right? So, like, when you're in a residency program, you'll do some off service rotations, surgery rotation, a trauma rotation, things that are really relevant to your career. But you're spending 80% of the time working in the ER with someone as your superior who's supervising everything you do, like you saw on the Pitt, right? With Dr. Robby watching his residents. And as you progress in your residency, you get more autonomy, you have more skills, you have more baseline knowledge. You continue and you sort of end up with your patients, and your level of supervision decreases as you progress. So, but when you're training for that, and depending on where you are, that you learn very quickly that no day is predictable. I do like to tease we have themed days. So you'll have a syncope Sunday, everyone's passing out after church. You'll have like an abdominal pain day, a chest pain day, a stroke day.
Yeah.
But what's actually coming through the door is totally unpredictable. And that's probably where I thrive the most. Like the more critical or heightened the situation is, like the calmer and I don't want to say like more fun I have. There's something called like the flow state. I don't know if you guys are familiar with this.
Oh,
Mm.
yeah.
Yeah, but I think that like that's really where I like just focus in and just enjoy everything I'm doing. Like
Yeah.
I'm 10 years out of residency and I love it. I love what I do.
Yeah. It's almost like on the show they had that theme. It was like it was nursing home patients, right? They came in. It was like every day at such and such time we're gonna get
Yep.
3. I think they kind of like that, right? They had the
That's the
same.
truth. I don't know if
Yeah.
like they just start the nurses do the rounds at the nursing home and then they're like, oh man, like we need to get these people evaluated and they just ship them out. So change of shift always tends to be a high time of influx. So no, they represented that well.
Wow. Wow.
That's so funny. People are, even though it's unpredictable in the ER, some of it is somewhat predictable, right?
You do learn what I call like pattern recognition. And the big part of your training is learning like when it's okay to fall into that pattern and then how to still keep the outside eye of like, could there be anything else going on with this patient? Because that's is a lot of
Mm.
what we do too, which I think was represented in the show. People come in with nondescript complaints and there's this like magical idea of, oh, I'm going to go in and I've had this pain for 3 months, but I can't take it anymore. And they're going to find out exactly what's wrong with me. And that's not necessarily true. Like my job is something life or limb threatening imminently for you in the next 30 days? Like, is there something that I must identify in order to save your life? And I sort of give this speech to my patients too. I say, my job number one, I have to make sure nothing life threatening is going on. I'm very, very good at that job. Number two is I want to make you feel better. And I'm going to focus on that. I'm going to try to do whatever I can, whether it's reassurance, whether it's pain medication, whether it's follow up. If I can do those things to make you feel better, I try. And then number three is figuring out exactly what's going on. And most people don't want me to get to number three because I find the bad stuff, which I
Mm.
think kind of reframes the mindset that a lot of people have when they come into the emergency department. And I do have to say this a lot too, is like we need to manage expectations, like what people are thinking they're coming in for and what the service is that they want versus like what we're actually there for and what we're able to provide.
So there's a disconnect, and that was on the pit too. That disconnect between
Yep.
expectation of you're going to fix me
Yep.
versus what you can realistically do in that moment.
I mean, there's a lot of discrepancy with resources and follow up. And, they didn't really, I wonder if they'll get into this next season, but they didn't really show the lack of physicians that we have. We are in such a physician shortage. And, 3 years ago in the match, when we went through the matches where you, as a medical student, apply to the different residency programs, and then you get matched in with whatever residency you're going to be accepted to and go to. It's a pretty complicated process, very nerve wracking. I mean, it's fun for me now because I'm a core faculty, so I do the interviews. So it's like, all right, who's on our team, who's on our roster next year? But as you're the one doing it, it's very nerve wracking for them. Um,
So would you say, in general, is the pit an accurate version of what it's really like in the emergency room?
Mostly yes, like 80% yes. The only thing I'll say, which I told my husband this, so my husband's a chiropractor and he has a ton of admiration for me as like an emergency medicine physician. And his chaos and my chaos are very different. But he's like, is it like this with like the acuity and the procedures? And I'm like, like what they did in one shift, I've done over 10 years. Right. Like they did probably 10 of the most high intense procedures that we do in emergency medicine. They're just not quite that common. It's really fun to see it represented. And like those are the days when you're like doing those things that are really invigorating, but that's not like every single shift. I don't have a mass casualty incident with like an influx of 50 patients from an active shooter. Luckily, they did a lateral canthotomy on a kiddo and they cut the part of his eye. I don't know if you guys remember that scene.
Oh, yeah, yeah, yeah.
I've done that 3 times.
Ooh.
They did a bunch of crikes. Like I've done that twice. Like it's just not something that I do all in one shift. But I think the social aspects that they showed. So I think it's scene 1 where an administrator comes down and like, we really got to work on our patient satisfaction scores. And he's
Yeah.
like looking around like at all the patients in the hallway and the waiting room. And he's like, okay, I'll go fuck myself. Like, which you guys have to tell me if my potty mouth is accepted or
Oh,
not
that's
for this.
fine. Yeah, it's totally fine. Yeah.
Okay.
It's all
Yeah.
good.
It's so true though.
We come
Like,
from
If
production,
it's not,
so
we'll tell you to go fuck yourself.
please do. Just tell me.
No.
But no, and that's so true. Like right now, I literally am dealing with it at my shop and I love where I work. And I think that there needs to be some acknowledgement of patient satisfaction. There has to be like a minimum level of acceptance in what we do. But when you're looking at everything we're doing, there was a podcaster, I think it was Z Dog was what he goes by. And he's a doctor. And he made a skit and it said, what's your patient satisfaction score in the emergency department? Did you die? But like, did you die? If you did not die, you should be 100% satisfied. Like that. But,
I agree with that.
for us,
Yeah.
it's like, oh,
Yeah.
I didn't get to eat anything. I had to wait 4 hours. They looked stressed and tired when they took care of me. Just stuff that feels really
well,
of not
it's
important.
not like, going to Nordstrom's and getting customer service.
Right.
You're
Not
like,
with teas, it's like not Burger King. You don't get
you
to have it
know,
your way.
I
Like
mean,
order
I've
what
been
you
in
want.
Yeah. I mean, I was actually on a shoot one time in Manhattan, and it's a really long crazy story, but I was basically looking one way and moving another way, bad idea, and I came in contact with the corner of a granite wall, which split my eye open, and I had blood
Jesus.
just pouring down my face. Like it was like you could feel the wet stickiness of the whole thing. It was bad. And my associate producer was like, "Oh my God." And I was like, I know, I got to go to the hospital. But I'm on a shoot and I've got like characters and cameras and all these people. And I was like, all right, guys, you all deal. Here's the story. And I jumped in a cab and went to like NYU
Yeah.
hospital at 9 on a Friday. I do
Okay.
not recommend
Yeah.
that because even though my cut was pretty nasty and it needed attention, it was nowhere near as important as, these car accidents or whatever else was coming through the door. And I had to wait. I had to wait till, I don't know, 2, 3 in the morning. And then I got, luckily they had a plastic surgeon. So I have like 20 stitches above my eye, which you can't really see.
We love having
But it was not fun waiting in that
that.
lobby.
It's not an enjoyable experience. Like you don't go there to rest or relax. Like that's the other thing people say, like they're tired or it's noisy. It is. It's an emergency department. It's chaos. We live in semi-organized chaos. And that level of like heightened awareness is the entire shift that you're there. So, and no
Wow.
one wants anyone to wait. Like that's never an objective, and sometimes I try to approach patients when we're in surge times and the wait times are really terrible. And I mean, we feel horrible. That's not what we want. And I usually try to walk in and just say like, thank you for being patient, and it just depends on the individual and what they're going through. Sometimes they are receptive and can kind of understand our position, but a lot of people aren't. And I guess, I would tie this into pre-COVID, post-COVID. Society post-COVID is a lot more tumultuous. It's a lot more aggressive. It's a lot more angry, less tempered, more.
And you've seen that in the
Oh,
emergency room?
absolutely. You can see it in your level of psych patients,
Wow.
violence, which was another thing that the Pitt brought up, which I was really appreciative of. People don't realize that healthcare workers get assaulted regularly. I've
Wow.
been swung at, spit at, we've had weapons, like it's dangerous. We have active shooter drills that we practice for because we're in a high risk environment. And that's one thing that I stand on. And I like that the PIP brought this out to like give some, community awareness. I don't know that society at large realizes day in, day out, like we are at risk every single day. And, there's a nurse that was assaulted in it. I can name several situations. So
Really?
yeah,
That was not an exaggeration
no,
of
no,
the nurse. I think she was hit in the face, right? Wasn't she
she was,
punched?
Yeah.
yep.
So that's not
We
an exaggeration.
No, we've had people punched and choked and strangled and, um, we have so many things in our like arsenal to try to prevent that, but people aren't predictable. And when you
Like
think,
deadlifting, you just gotta
well, it's funny because I am like, it just depends. Like our security, we have security and they try to be really protective of us. And I guess of me, when I was pregnant, they wouldn't let me get near like half of these patients. And I'm like, guys, like I probably am stronger than this. Like I can handle myself. And they're like, no, no, doc, stay back. Like we got it. But
That's
I mean,
wild.
we're laughing and joking. And I think you have to, right? Like that's how we cope.
Yeah,
Um, but it's been hard, and that we saw a huge drop in interest in emergency medicine. People don't want to do it. It's dangerous. You have to self-sacrifice. Like I said, even just with COVID and the idea of contracting the illness when we first came out with it and knowing people died and you could take it home to your family and that they could die. And people didn't want to do it. And so part of my excitement for the pit is to, you know, reignite a passion for our specialty because it is really amazing and fun. It just takes really specialized individuals to be able to do it and do it well. So the idea that we can bring out some attention and some drive and desire for more emergency medicine physicians, if the pit did that for us, then the show is abundantly successful in my eyes.
that's great. That's great.
Yeah.
Well, it's a huge compliment to the show that you would even wanna watch the show because
Yeah.
right?
I
Like
so I think
like
I
Sean was telling me that he was watching it while he was eating, and the lady that got hit by the train comes in with the and he's like, "Ah, I'm eating."
so like I'm the
Like
freak that like actually sees that in person and then goes back and to have my lunch and I'm just like
Yeah.
but I have to confess, like, if I'm representing, like, our specialty, I think I'm an outlier. I don't know that a lot of us like, I talked to a colleague yesterday about it because we were all excited about, Noah Wiles' Emmy Award winner, and he even gave a shout out to healthcare workers, which I thought was fantastic. Like, he's just a classy guy, at least, from what we can tell in our interactions and media appearances. But we're talking about it, and he said, I tried to watch it. My wife really wanted to. She's not in medicine. But after doing it all day, I needed a break and to decompress. So, I was different. I just thought it was so well done. I had respect for it. So even if I had worked a shift, if there was a new episode, I'm like, yeah, let's watch it because I just had an appreciation for it. But I don't know that I'm the norm for that. I think a
How
lot of
about
people had to watch it, like, when they've been off for a few days because it did hit so close to home.
wow,
hmm.
wow. Did you get into what is it, Grey's Anatomy or any of the other ones?
No, it's too much
General
drama.
Hospital, if that's
It's
still on. I don't even know if that's still
Oh
on.
my god, my
Yeah.
mom is a huge General Hospital fan.
Yeah.
No,
Yeah.
I watched a little bit of Grey's. It would be one of those, like, studying, it's on in the background. So I think that was when I was in med school that was really popular. Um But it was just like, I mean, sure, there's some drama in the hospitals, but like every single person sleeping with every single person and like the attending resident relationships. It just was like they went so over the top that I lost interest, honestly.
Yeah. Yeah. Yeah.
And I feel like
Yeah. Because
the pit did a really good job of like putting in some social stuff and some drama. I loved that one of their characters had a problem with opioid addiction, right? Like that's a huge thing.
That
And
was incredible, yeah.
it was very well done. I've luckily not had to handle any of that from like a professional standpoint, but we do see it in society with patients every day. And like this idea that it doesn't matter what you do or who you are can keep you from an addictive process is not true. It's a disease. Anybody is susceptible. So keeping that mindset, like that you have to be aware and supportive of every human and individual. I don't know. I thought that was very well done.
Yeah, that was an incredible story because they built they made that guy very likable, and he was, like, the number 1 guy. They put a lot of Noah or Doctor Robby put a lot of trust in that guy. He was clearly, like, the number 2, and then he turned out to be liable because he
Yeah.
kept sneaking off and doing drugs, and I don't know, that was a good story.
I thought, like I said, I thought they did a good job and it's very plausible. I think that that is potentially something that could happen. I mean, I don't know. We're pretty open and regulated. And actually, the one thing I'll give a shout out to as far as like support, my organization, I work for Bay Health in Delaware. We have 4 emergency departments, 2 freestanding and 2 actual full-fledged emergency departments attached to hospitals. And they created this vital work life. And in that program, it's counseling and professional development and therapy. Like if you need anything, if you're struggling with any aspects of mental illness or drug or alcohol use, and they try to make it very supportive if you're somebody who recognizes a problem and goes for your own help. So just to like have that support from an organization, I feel like is pretty special. And I don't know that all places are doing that. I think part of why I've only worked for this organization after residency is because it is such a solid foundation and invested in the employees and the community.
Well, that was another story point that they talked about was the trauma that Dr. Robby had been through post COVID, like going through, they kept flashing back
Yep.
to all the horrors of COVID, and he was clearly suffering mentally and emotionally because of that. But when you guys see trauma day in, day out, like you said, you go see this broken leg and go back to your lunch, like you're just seeing it all day long, every day. It has to have an impact on you on some level. And I thought that was a really interesting storyline as well.
Sometimes I'll tease that I worry I compartmentalize like psychopathically because I just find that I can put things into silos. But even personally, like I worked in the thicket of COVID. I started my administrative career February of 2020. I had impeccable timing.
Wow.
Um, yeah. So I'm a month in as an administrator, assistant medical director, and they're like, all right, so worldwide pandemic, what do we do? Help us, help you. Um, but no, I have some like PTSD moments from it. I think that physicians, we preach wellness now and you have to take care of yourself because you can't take care of anyone else if you're not taking care of you. And Jen, you know what I've been through personally. There's even more to that backstory, whether you want to get into that or not. Um,
Sure. I mean, if you want to talk about it, it's
sure.
part of this,
Yeah. So I have been married previously and my late husband passed away from acute leukemia. And he
Oh,
was
sorry
diagnosed
for your loss.
15 yeah, he was diagnosed 15 months after we were married. He had a
Ugh,
4.5-year battle. He passed away a little over 3.5 years ago now. He was 40. And
Mm.
I remember I'm working in COVID and people would get sick and they would just drop. I think I did like 10 or 11 shifts in a row, which I don't know if you guys like to have no days off and do what we do. It's
that's
just
brutal.
yeah, really taxing. But even more so was this like fear that I would come home, have it, spread it to him, and he would die, right? Because he was immunocompromised. And
Ugh,
the stress related to that. I was telling a couple residents, because my residents that are coming up now, we're post what, 5 years for COVID. They were pulled out of rotations when it first started. Like we didn't put the youths at risk. It was more of the old school attendings, the Dr. Robbies that stayed in and manned the wheel. And, I was telling him, I remember sitting at and what we call the fishbowl where the docs all sit. And I've got a N95 mask on, a surgical mask over that, a cap on, a full-fledged gown. I'm double gloved and a shield, a face shield. And I had just intubated a patient, just put the breathing tube in. And, that was the most dangerous procedure you could do because you're just literally taking all those aerosolized viral particles to the face.
Wow.
And so we try to like protect as much as we can. And I sit down and I think, oh my gosh, I have a fever right now. I'm sweating, I'm dizzy, and I'm trying to chart on the procedure and the like life-saving measures that we just did for this person. And I'm like, am I gonna pass out? And then I'm like, if I pass out, who the hell's gonna run this place? Like, what are we gonna do? I'm the only one here right now. And there was just this like intense sheer terror and pressure. And like literally I just like a few deep breaths and then I'm like, okay, we're going to keep going. And, the outlet for me has always been working out. I like meditating, I like journaling, but like working out. And I remember a couple days post that shift and I never tested positive. I have no idea how, but I was given a rower from a friend of mine who owned a gym and I'm in the driveway and I'm rowing and I'm like half capacity and just gasping for air. I'm like, "Am I sick?" "Nah, I'll go to work tomorrow." Like, and that's just what we dealt with, and then I don't even remember when we, like, came back up for air, when we felt like we could
I was
breathe.
just gonna ask, like, so that was February of 2020
Well, it
when
didn't
it
hit us until well, March kinda started in the States, and then it was, like, April, May, June. Yeah, and it was a year of some pretty hellish times, like, people the only thing I can compare, like, that last scene in the pit, the last, when they have the, MCI, the massive trauma, mass casualty incident, and there's just people everywhere and equipment and blood, and you're just doing everything you can, and I remember that feeling, like, I remember having patients intubated in the hallway and, like, doubling up patients in rooms, like, significant others, and just people dying all the time, every shift. There's
so
nothing you could do.
at the height of COVID when that was happening, so that was real, like, people were coming in, bodies were in the hallways,
I mean, not
and
deceased
how
bodies.
well, you know what I mean,
Like, the
sick
physical
yeah, sick
like,
people.
physical bodies of sick
And
people.
and
Yes.
on average, how many people were dying a day? Like, how many
It would depend. I mean, we had a toll. I don't remember what our max was. I mean, just depends. We would look at the state level deaths, we would look at the countrywide level deaths, we'd look at our each hospital that we were at and compare, and, um, I mean, but it felt like 50%, yeah, of the people who had it
wow,
who were really, really sick. Um,
wow.
one of my nurses who now I'm gonna get a little emotional, but who I love and adore, her mom, I think, was the 3rd person to die from it,
Oh my gosh.
and her mom was young and healthy otherwise, and, she's still some people will throw in, like, something political or something about the vaccine, and she's just, like, immediate, like, war face, because society at large, if you weren't affected directly, were so dismissive of the terror and the catastrophe that it truly was. It was I mean, we make jokes as elder millennials of, like, all the things that we've been through, and we'll someday tell our kids about surviving COVID. I mean,
Wow.
you were in New York,
Yeah.
right? I
Yeah.
assume.
Well, yeah, for a minute. I mean, we were in New York until our gym closed. And then we were like, well, we can't be here if the gym closes. I want to be in a place where you can go to the gym
Yeah.
because to me, if you're going to the gym, you care about your health. You're taking care of your health. And if you're going to be around any people, those are the people I want to be around. And so
Yep.
we went to Delaware to go to the gym.
I think that well, we were really lucky because so that's how Jen and I know each other is gym and working out, and we were really
Well,
lucky.
actually, yeah, that's when I met you.
Yeah.
I would train we trained with Chris, your husband,
Mhm.
back then, and, he was the first person we met at the
Yeah.
gym, we would come in at, like, 7 in the morning when no one else was there, and, it
That's
was
what he
like,
would do.
"Okay, this is our COVID tribe because we're all working out. We don't have masks on, but we're in the gym, we're working out, we're
We had
doing
so much
this."
space, which we were
And
really, really
yeah,
fortunate to have.
and Chris was in our on our little workout tribe.
Yeah.
But this was before he was sick. I think he was, in remission.
Yeah, he had, 2 different remission spells. So he
Yeah,
did a double umbilical cord stem cell transplant. Shout out to University of Penn and their amazing research. Which was a pretty new age thing. And I think he had 8 months of remission from that, and then it came back, and each time it would come back, it would be more aggressive. And then he tried to do a half matched, bone marrow transplant from his brother, and then
right.
that failed. So, I guess my one other plug would be, he had no matches in the National Bone Marrow Donation Registry, so if anybody's never, like, registered for bone marrow donation, like, just as a swab of your mouth, actually, a cool
Wow.
story, one of my nurses that I work with, because of what Chris was going through, she went and entered into the registry, and she matched with a young girl, and she donated her bone marrow and saved that girl's life.
Wow.
Yeah.
That's all it takes.
what does donating bone marrow,
So
what does a person
it's
go through?
yeah, it's a little, I mean, there's far worse things, but several blood draws, and then the bone marrow itself, there's a few places that they can take it from. And, I'd actually have to fact check myself on what the most likely site is. It's probably in the back or the buttock, but like kind of a bone drill goes in and
Oof.
it's sort of like siphoned out with a syringe. It's an outpatient thing. So I forget where she did hers. It might have been Johns Hopkins, but she went over for the day. She actually dropped her blood pressure, which she's somebody, I think when she donates blood, she does that too. So they kept her a little longer. I think she was there. Max was overnight, but most people go in and they're gone in 4 hours and you're a little sore for a couple days. And that's it.
But you're
And
saving
then
someone's life.
you
A
as a
full,
donor, and you as a donor, that grows back, right? Like your
oh yeah.
bone marrow. Yeah, yeah.
Yes, you're
It's not
fully
like a
regenerated.
kidney. It's not like a
Yep.
kidney. It's gone. It's gone. Yeah.
Correct. Nope. Something just like when you donate blood, your body will, reacclimate and red blood cells will be produced and you'll be back to a level where you should be. Now, if you continue to withdraw, like your body can only keep up so much. So, and you have to go through a lot of qualifiers to like be a person who can be a donator. Um, but if everything aligns, yeah, it's a very viable option for a lot of those bone marrow and blood based cancers.
Wow.
That's good to know.
Yeah.
It's very
Yeah.
good to
Yeah.
know.
We
Yeah. It's
did a
not even
little,
something I was even aware of. Yeah.
yeah. You can just, I don't know, you Google it or whatever, but you can just ask for a sample to be sent to your house and they send you like a little mouth swab and you just swab your cheek, mail it back. And then they'll email you every year or so and ask, do you still want to be left in the registry for donation? Would you still be willing to do it if someone called upon you? So it was pretty cool. And then the other really amazing thing that we did after Chris had passed was he never wanted a funeral. He wanted a celebration of life, which would raise money for Leukemia and Lymphoma Society. So we did exactly that. And he was huge in the community and really well loved. So we had a bunch of contributors, including my hospital system, with donations and gifts. And we did a silent auction. And he was in the restaurant industry. So we had, the facility that hosted us donated 30% of all of their sales to him. And we raised $76,000 in his
Wow.
name, which
Wow.
the American Heart Association, excuse me, not American Heart Association, Leukemia Lymphoma Society, that's the most money raised in one event by a single person for a single person.
Wow.
Wow.
Yeah. So I have a really
Congrats. Wow.
beautiful plaque from them that I actually keep in my office at work.
Wow.
He was a lovely guy, and I remember meeting you. We were at the strongman competition down on the
Yeah.
beach, and I saw Chris because he's our gym buddy. Like, hey, Chris. He's like, hey, I'm with Julie. I'm with my big girl. I thought that was so funny. He was so proud of you. He's like, I'm with my big girl.
Yep.
'Cause-
I've
um,
uh, I've been really fortunate in this life. I don't know, it sounds crazy. I remember like going through the thicket with him, um, and I just felt like, why am I being punished? And in this like meditation session, I had this really true epiphany, and I was like, this is your privilege. Like you're the only person strong enough to like go through this with him and like take him through this, and like it's your journey. It's not your punishment, it's your privilege.
wow.
Like, now I'll get emotional, but like I look at my life now, I had zero idea of what was in store for me. The concept of like meeting someone who's just as equally amazing as he was and equally as empathetic and kind-hearted, but who meets me on a very different level, and to find another human to love, which is what he had wanted for me, right? But I've found this incredible person and we have a family now. And to be a mom and to have that privilege, it just, I am so lucky, even though I've been through such heartache. And I do, part of me has this spiritual aspect where like Chris sent that to me. Like he manifested that I was going to have this amazing human and actually get to truly be loved and like have the opportunity to live the life that I get to live now.
He did.
So I think a lot of like my perspective and my outlook and my attitude is because of everything I've been through. I actually think it's made me a much better doctor too. You know, I take care of patients and there are frustrating patient populations and people can be at their worst when they're with us. And I've seen it and I saw it personally. And so I have more empathy and understanding for those patients and families that are really struggling. And I think that it's made me better. You know, actually, Dr. Robby talked about it was really, I love that he knew this, but there's a way to be perceived by others when you're working. We kind of tease there's like an A team and a B team. And some of it's like skill level, but a lot of it's attitude. And you want to be that person that when somebody's looking at the schedule that day, they're like, yes, I'm with Dr. Cullen. I love her. It's going to be a good day. No matter what comes through the door, like today's going to be a great day because we have a team that wants to be here, that's going to work hard and we have each other's backs. And like, that's the beautiful thing. And I think that's how I ended up as a medical director, because I have like that quality where people gravitate and to be told that like day in and day out, like, you know, I wasn't feeling really good or I have something going on personally, but then I saw I was working with you and I'm like, you know what? I can suck it up. Like everything she's been through, like I'm going to go in and put my best foot forward and we're going to save some lives and take care of some people.
That's incredible.
Yeah.
I mean, what you've been through is no joke. Dealing with COVID and a very sick husband going through what he went through, that was not easy.
Yeah. But I think it's given me a different perspective and a different outlook. It's one of those like, if you've seen true darkness, it makes you appreciate the light and the sunshine so much more. So I really, you know, I try to push that on people. Um, we were talking the other day, and we're in a surge season right now, so we're really busy. We have a lot of holds, and so we're seeing patients in the hallway, and it doesn't feel like it's our like most ideal environment. And the doc I was with, and this is like I got pulled aside, like, and this is why you're a leader and you do what you do. But he was complaining, like, how are we going to do this? You know, we have 28 people in the waiting room. You know, we only have 28 beds and we have 24 people admitted. So we have 4 beds to see people out of. We have ambulances coming in and out. You know, we're going to open 10 more hallway beds. Like, I hope we can take care of these patients. And like, this is terrible. And I was like, yeah, but we're here. We're on this side. So we're going to do everything we can for them. And then we're going to be able to go home and hug our spouses and hug our kids and enjoy some nice food and a nice glass of wine or whatever it is that makes you happy. And we're happy and we're healthy and we are so lucky. Like we are the lucky ones. So like, let's give everything we can for the next 10 hours. And then we can clock out and be truly satisfied that, okay, we did everything we could.
Wow.
Wow.
I mean, it takes a special type of person to be able to give like that and take care of other people for how long are your shifts? 10, 12,
Yeah.
15 hours?
We do nines, tens, and 12s. It depends where you're at, weekends. We have like kind of different schedules. So the 12s are rough. I like to tease that after like 10, 11 hours of my critical thinking gets very depleted. I'll come home and Zach will ask me what I want for dinner. I'm like, no questions. No, just figure it out and feed me, please. I love you. Thank you.
In the pit, they're 15-hour shifts, right? Is that
Well,
unusual or is that
yeah, well, that was because they had that trauma, the mass casualty incident. So it's called an MCI. I'm actually, as a medical director and somebody who, whenever I see something that I think could be done better, I just can't sit quietly. I have to try to fix things, which is how you get stuck in administration or leadership is when you just don't sit quietly, like, we can do this better. So I'm on a board right now that's kind of coming up and perfecting our MCI. And that is something that you would do. You would, you know, call in people early, have people stay late, all hands on deck. And we have like tiered systems. So it would depend on how many patients you are expecting and how many patients you get and how many resources you need. But no, I mean, we do that. I've done 16-hour days. There are some docs that do 24-hour emergency shifts if they're like in a really rural emergency department that's usually not super hectic. Um, you know, when I was in residency, we did 30-hour call. So you would start at 5 a.m., on a Tuesday and you wouldn't finish until 2 p.m. on a Wednesday. We've gotten nicer with that, I think, with like wellness and kind of trying to protect our own. We've set a little bit more limits on it, but we put ourselves through a lot emotionally and mentally and physically.
Yeah, it's
So
tough.
that is a tough job. Almost as
I mean,
tough as
well,
production. No, I'm
well,
just
I was
kidding.
gonna say, well, that's what I was gonna say. Is like we have our long 15-hour day or whatever, and we think it's tough. But what you're doing is it's a whole other level, you know.
Oh, yeah. No,
Yeah,
a
well,
whole other.
I think that that's like what's sort of the beauty of the pit, right? Like, and one of my other favorite quotes that Noah Wiley gave us when he did our panel at our ASAP Scientific Assembly, which this actually got me pretty in my feels and emotional. He was saying that he wanted to be able to produce something that children could look at and our children would be able to watch that and have like an admiration and be like, oh my God, mom, like that's what you do. Like that's who you are. Like, you're a Dr. Robby, like you save lives and take care of people and you're in sometimes the shit of shit and you come home still like with a smile and like, I'm so proud of you. And it's really, you're a hero. He's like, and so if we can project that out, then like we've accomplished one of our goals. And I just felt like that hit so hard. And he actually said that he got a lot of support and that's part of what gave him the invigoration to do this is because we were reaching out to him as an emergency medicine community and we're saying you're representing us beautifully and you're doing a great job and we appreciate everything that you're doing. And he just so beautifully represented us and did a lot to give truth to like our story. And the fact that he took so much pride in that, it was beautiful. And like the idea that like my son will someday get to watch the show and hopefully have that like epiphany moment. Um,
Like my mom's Dr. Robby.
it just makes you have, I don't know, have all the good feels because it is what we do. And people really have no idea. I've always said, anybody I care about, I would love for you to be a fly on the wall with me for a shift. Because I think you understand and have like an appreciation or, kind of this deeper connection. But after you've actually lived it, you're just likely most people would be pretty shell shocked.
Yeah,
Well, that's what
I'm good sitting here and
You don't want
I
to
don't
come
need to
hang out?
go in. No, yeah, no, no.
well, that is the wild thing about fiction is that, we work in nonfiction, obviously, mostly. But with fiction, like you have to pay attention to the details to be able to create the world. And it seems like they really did, like down to the tools and the terminology. Like it's a whole language that
Yeah.
that
That
that you guys speak and the actors had to learn and know. Do you think that it was accurate in that sense?
absolutely. And it was cool when they did the panel for us, they actually broke down their set and then showed us a lot of the behind the scenes of how they did the production for it. It was really remarkable. And then they were talking about some of their casting coaches. And I loved this quote from him too. He was like, part of it wasn't just how do I suture and what does that skill look like? What are the words that I'm using? Like, how do I explain what a tachycardic hypotensive, hypovolemic shock patient is and know that I know what that sounds and be confident. But he said they gave coaching on their level of training and their level of terror of like how much they need to be scared and concerned versus like their level of confidence and cockiness. And so like each person, like the medical students are like shitting their pants, right? And that's true. And the first year residents, and it just depends. And you kind of continue up that hierarchy, like I said, as you get more experience in training. So the fact that not only do they teach them skills, medical terminology, but also like the true interpersonal connections and dynamics. There's also scenes with like surgery. And so we kind of tease that like a lot of the other specialties don't like us in emergency medicine because we make them do more work. I'm calling you because I need you to do something for me. So we don't always get like not everyone's like, oh yeah, it's the ER calling. So that there was like quips between surgery and emergency medicine. And some of that dynamic is true. And I thought that was represented well. Um, I will say that I think, it just depends the shop that you're at. And, we would make jokes about not liking each other, but two of my best friends are trauma surgeons. So, and like one lived down the road from me and we hang out on our time off together too, which is probably annoying for those who aren't in our field because we just, like shop talk the whole time. Um, but like there's like a little cockiness to surgeons. And
A
so
little? Are you kidding me?
depends on the person, I think. But like rightfully so, like they do insane, amazing things and they have such a talent of skill. You think back to where we've come in science and medicine and what we can do, it's remarkable,
Oh,
and
yeah. No, they deserve
um
it. They
yeah,
deserve to have egos for
yes.
sure. They're doing
Who's going to be replaced though? You, the doctor, or the surgeon?
What do you mean?
Like is by AI robots? Who's
Oh, I don't think
Oh.
I don't think either. So like there's I'll give an example. So we have EKG machines, right? And that's telling us, are you having a heart attack or not? And people will freak out because they'll read, like the machine will give a read. It'll say like, oh, this is the big one. This is the STEMI. Or they'll say this is normal. And I promise you 50% of the time it's stone cold wrong. So like I don't think I can be replaced. The so
So
like
what makes the difference? What makes the difference?
I don't there's clinical intuition, there's a clinical picture, and there's just like you can't program to understand the complexity of the human being. Even though AI is trying so hard, I think like radiology, we're getting there with some progress and like AIs for looking for a blood clot in the lungs or looking for a bleeding brain. There's diagnoses and specialties that'll happen. But like emergency medicine, we are so critical thinkers and we'll try to come up with like rules and tactics and tools. But I'm telling you, so much of what I do is intuition and instinct. And that will never be replaced by AI. You can't program a machine to have intuition and instinct. Additionally, like we have physical skills, we're doing procedures, we're doing things with our hands. And then the third thing is like that heart, like that hold that patient's hand, comfort them, console them, educate them, like that aspect also I don't think could ever be done by a machine or we would be replaced by AI.
Do you
You know
have
those
an
those
example
beds?
of
They'd come in, the patients would come in on the bed and they had that contraption that went over their chest and it was like doing the CPR.
The Lucas device, yeah.
Yeah, is that a newer thing? I mean, knock on wood, I
Uh
haven't been to a hospital, so I don't know. But
no, I don't know. Maybe I'm trying to think how long that's been more mainstream. At least 5 to 7 years. We've done studies. I should say I've not been a participant or researcher in any of this, but there were studies done to look at like the efficacy of like a human giving CPR versus that machine, and it's pretty adequate. The other thing too that a machine can do that the human can is it's exhausting to give CPR
yeah,
physically. So when you get to a certain level, if you don't get a return of spontaneous circulation or someone's heart to beat on its own again, that machine is been shown to be very efficient. So that's real. We use that every day.
wow, wow, it's
but
pretty
is
cool.
that considered is that AI though or no? Or is that
No,
just
it's not AI. I don't think it would be, but I mean, it's a
just
machine.
more mechanical, right?
Yeah, it'd just be robotic. I don't think I'd consider it
Robot,
AI.
yeah,
Yeah, yeah.
yeah.
It's,
Do
I
you
mean, controlled just with like buttons, like we control it, like start it, stop it, that kind of thing.
do you have an example of when your intuition played out for a positive outcome? Where it was truly like, I don't know, but I'm just gonna go
Oh
on
my God, all the
this.
time. Oh, it happens every shift. And I love those moments. And like the couple of the coworkers tease me, like there's this quote where it's like, well, she's not always right, but she's never in doubt. And the other quote that I like is, I'm not always right. I'm just not often wrong. And so I actually have
How
a
does
book.
how does Zach feel about that quote?
Oh my God, he hates it. So my husband, as much as he like admires me and wants to like put me on a pedestal, he's the first one to just bring me right back down. You're just as human as the rest of us, But when he talks to anyone else besides me, it's just glowing, Like we first were dating and I would go meet someone out and, it's a small town where we are. And people would be like, oh my God, are you Zach's wife? You're the doctor. And like, know all this information about me. And I'm like, I'm so sorry. Who are you? like, um, No, but I have a book which I almost could pull up, and it says all the times I've been right and no one listened. And it's actually a coworker of mine who was a medical director that gave it to me, which I thought was really funny. But I don't know, I have so many good stories. I had one where it was a really young guy who came in and he looked short of breath, and he actually was being seen initially by one of my PAs. And I walked by the room and I was like, "Ooh," I'm like, that guy's gonna code. Like his heart's gonna stop. Like he has a massive PE. And I just the way he was breathing and his appearance and his vital signs, like I didn't even do any more in a physical exam. And I went up to him and I said, "Hi, I'm Dr. Cullen. I'm the supervising doctor. We're working on some things, but I want to put a central line in you and do this procedure. It's kind of invasive, but I think it's going to be important. And maybe I'm being overcautious, but I'm not often wrong on this. So let's just do it." And he was like, "Doc, come on. Like, I'm fine." And I'm like, "No, let's do it." And so I also went to my charge nurse, who is now our ED nurse manager, and I love him. And he teases me about it all the time. He's like, Cullen's spidey sense is up. Like, pay attention. If she's telling you, like, it's going to happen, I'm just warning you. And so I went to him and I said, "Hey, let's get the TPA, which is a clot busting medication we use. It's high risk, high reward." I was like, "Let's get the TPA out." And he was like, "Are you serious?" And I'm like, "Yeah, I have a feeling." And he was like, "God, I hate when you get these." And 15 minutes later, his heart stopped. And we did CPR right away, gave the clot busting medication, had everything already ready that we needed, like if this were to happen. And
Wow.
then it did. And then we got him back immediately. I got him actually with a vascular surgeon to like pull out the clots that were in his lungs. He showed me photos of like how it took up just the entire middle of his pulmonary arteries, what we call saddle
Wow.
embolism. He should have died. But he didn't. And 10 days later, he walked out of the hospital and, called me a month later. Well, another really good story that I love, and I'm still really
That's a
close
great story.
because I love this one. And if we need to cut these off, you can certainly tell me. But I think this one's really beautiful. Had a patient came in, she was sitting in what's called a vertical bed, which is like supposed to be like in and out, like easy. She was telling me about kind of this weird headache and some vision changes and then this kind of pain that radiated. And she's like, "I don't know, but just it's weird. It's gone now. I feel okay." And there's something called an aortic dissection, which is where the inner layer of your aorta separates from itself. It can balloon out. It can get so large that it ruptures, and then end game, you die. It's actually sometimes a hard diagnosis to make because you need specific testing to find it. So she had kidney disease, and so you have to do a CAT scan with contrast in order to make that diagnosis. Contrast can injure your kidneys depending on how bad your disease is. So it's sometimes not recommended. And some people come and be like, "No, no, my doctor said I can never have that because I have kidney problems." And so we always have to like then do this backtracking education of like, well, there are certain times that we need to. So I did a CAT scan of her, no contrast. It was red as normal. Didn't see anything wrong. I go back in. She's talking about like, "I think I can go home." And I said, "Just have this feeling. I want to do this other test. Can you please," I said, "there's a risk to your kidneys, but if I miss this, you can die. And there's no way in my heart I feel that I can let you go home if I don't do this." And so she's like, "Okay, I trust you." And, that's a gift of what I have too. And something you have to practice and learn is to get a connection with someone and have them trust you in 5 minutes of meeting them. Right.
Yep.
And so she went with it. She had a huge dissection, the whole top of her aorta. It was going upper carotid, her axillary, just all. It was monstrous. And I remember looking through the CAT scan, and just you have this like, "Oh shit" moment. Called the
Whoa.
vascular surgeon. I didn't have anybody at my hospital for that day, so I called the shop up north. I hit the button for a helicopter to be there in 10 minutes. I see her just as she gets back, and I said, "Unfortunately, I was right. We're going to start this medication, and you're going to be transferred, and you're going to go to the operating room." And, she's like, "I'm terrified of being in a helicopter." And I'm like, "I'll give you some medicine to like help you relax a little bit, but like, we got to do this." And her husband, um, I think it was like a 10-hour surgery. And this was 5 years ago. And she still, we're Facebook friends. She sends me like Christmas cards and Christmas cookies, and we like check in with each other. And She had
Oh,
to come in a couple of times with her husband. Every single person that came in the room, she's like, Dr. Cullen saved my life. She was amazing. Like,
wow.
yeah. And it
Wow.
was, again, like I
Wow.
had a negative study that I could have, like AI would have just been like, oh, this patient's good to go. And I just stuck
Yeah.
to that intuition. And thank God I did.
Yeah.
Well, I'm
How
sure
did
those moments really stand out for you too, because, and I don't know if this is accurate in the pit as well, but most of the patients in the ER and the pit, they ended up, they died. Um, yeah, I mean, it was kind of like a show about
I
people.
shouldn't,
I
I
mean, I'm
should,
not laughing. I don't mean to laugh, but it was
no,
like it's intense.
slightly dramatized.
Okay,
Like I
so not
said,
everybody dies. Not everyone
no,
that comes to
no,
the ER
no.
dies.
I like to say that majority of my shifts, I'm like, no one died today. Not on my watch. I say that a lot too. I have so many, this is how I guess I know I'm aging, but I have my euphemisms and my statements and the repetitive, like colloquial things that I live by. So, but I'm like, no one died today, not on my watch, and having a good shift where somebody doesn't. The sadder ones are those people who have uh, an imminent life threat that's probably not something that we can fix, and they come in alive and then they die on your watch. And like, that's the worst emotionally. And unfortunately, that's what we had so much in COVID. It would be so fast. Somebody would come in talking to you. I remember specifically fighting with a retired ophthalmologist, and she brought her husband in. And the first thing she said to me when she came in is that vaccines aren't real and she doesn't believe in the COVID vaccine. As her husband's dying, this she wants to have this political debate. I didn't ask, I didn't bring it up. Like, I kept anything political out of patient care because I don't want to be biased about how I feel towards you. It doesn't matter who you are, you're a human being, and I'm just going to take care of you no matter what.
Right. Right.
And
Yeah.
he was argumentative and just so agitated. And I turned to her and I was like, he's going to die. So what do you want to focus on right now? And he did, like 7 hours later, and she died 24 hours later.
Oh, wow.
Yeah, both of them, husband and wife. So the like how to have a communication with society. And I hate that I think that COVID like drove apart that patient physician relationship. There's so
Hmm.
much more distrust now. Um, and that is so disheartening. Like just like any,
Distrust with doctors, or was
yeah, just the
distrust
medical
with the
profession,
mm,
Yeah.
medicine in general and vaccines. And it was so politicized and just, yeah, you talk about AI, but like Google, like WebMD, like there's a thing that the nurses gave me in my office and says, please don't confuse my medical degree with your Google search. That so many people come in and they're like, I Googled it, it's cancer. And it's like, no, it's not, or it's meningitis.
Well, that
I
was a story in the pit, like, somebody was
yeah.
like, "Well, no, I looked that up. I looked that up. I know what that is."
Well, and the same thing with vaccines, right? Like there was the meningitis case in the pit, and the mom was on this big thing that she doesn't believe in
Right.
vaccines. And the crazy thing is, the initial publicity that came out about vaccines causing autism was from a physician who has since been publicly punished for producing false data, right? But like once something gets media attention, you can't bring it back. And so it's just snowballed. And there's a whole other conversation, but I like that the pit brought out some of these challenging things, right? People come in all the time talking about how they don't want to vaccinate their children. Look at the measles outbreaks that we're having now. This is a
Yeah.
curable herd immunity done with disease. And I got really passionate about this. I have a 10-month-old. My son is not supposed to get that vaccine. If he gets a measles exposure and gets sick, he has a 30% chance of deafness, blindness, and permanent disability, and an 18% chance of death. This poor innocent baby, when if you vaccinate your child, there's no risk. If we're all vaccinated, we don't have it. The disease is gone. It's not here anymore. Same thing with polio. So this whole idea of mistrust in the science and in the medicine, it's so ironic because they'll come to you with all of their political feelings and their mistrust and their push for whatever agenda is there. And then the second they're dying and they're in that moment of need, then they want everything. And they want you to put yourself at risk and your family at risk. But they didn't want to follow any of the recommendations that were originally given. But now they believe in the medicine and now they want the treatment. And so that aspect, which was shown somewhat on the pit, is real life. Like, truly, I have dealt with that in many instances, and, um, it people you can get infuriated about it. Um, I wanna believe in, like, the right of a personal choice and having informed decision making, but there's where we filter media and where we filter information is so convoluted. And the information that's out, like, like my family, they'll send me things on Instagram. "Oh, well, look at this." Like, that's actually not a study. I don't Did you read the report? Like, there's no viable information in what you just sent me. Please stop wasting your time and my time. And then I'll, like, send something back that actually is true research that's been verified, and it's a little more challenging and complicated to understand and read, but trying to bridge that gap is a struggle.
So how would you recommend people discern, if they wanna do their research and find out about, you know
Use accredited organizations, like, look at the CDC, National Institutes of Health.
but people
Hopefully
doubt the CDC,
they
like,
do, they
people.
do, they have total mistrust in it. The research is there, and, I maybe it's a little bit naive of me, but, like, I can't even imagine less than a 1,000% chance that people who are in what we're doing are not there for the appropriate reasons, right? Like, you don't get medicine's not easy. You don't get into this to, like, make money or to manipulate people or to be evil. Like, this is the true, like, hopeful, angelic, hopeful, heroic career, and that's the agenda, is just to care for people. So when that gets totally thrown out, it's really heartbreaking for us. Look for published research, ask your doctor, ask your healthcare provider. And, you know, our pediatrician will go through and they have no problem, educating and having that. Just be so cautious of social media, be so cautious of Instagram, be so cautious of, look at somebody's credentials. Are they credentialed to make the claims that they are? A neighborhood mom who's talking about autism from vaccines, like, don't trust that person. They don't have that medical knowledge. Um, so I think having the idea of, like, being cautious of your source and not just putting out stuff that you can't or haven't verified.
Well, and biology is complex too, and the science is always changing, right? I
Yeah,
think
I
that's
mean,
part of the complexity is that
it
it's
is.
constantly evolving and changing.
And we can continue to grow and learn. Things that we used to think 20 years ago, 30 years ago, 50 years ago, it does. But that's why we have continuing education. Like, that's why, just because I graduated residency and I've taken my boards, like, I'm not done learning. You continue to learn all the time because we can always do better and learn more. And I think that the idea that you just, like, are done, or, that this is the only way for medicine or for this diagnosis or for this treatment, it's not true. And we're going to continue to try to grow. And, I trust science. Um, Maybe that's not the mainstream or, like, popular opinion, but, like,
You're
science is real. Like, physics is real. Like, chemistry is real. So
you're so controversial.
I know it's a challenge, and it's funny because, for the most part, I try to keep um pretty even toned. I have friends that are, like, anti-vaxxers, and um, I pick my battles because sometimes the argument there just there's not a winning, right? I think it shouldn't be like you win or lose. It should be an understanding.
Yeah,
And that's
yeah.
people don't want to understand. They want to sit in their beliefs.
Right.
Stem cells. Are they
Yeah.
are they all the rage, or we got a long ways to go yet?
What, right? Like, what are they
Yeah,
being used for? And what's the research? Like, so we did this umbilical cord double stem cell transplant. There have been
yeah.
people that have been cured from cancer with that. My late husband, unfortunately, wasn't one of them, but no other options were there. So it's like, and I loved his mindset. He wanted to, like, have this, I'm going to try this diet that I read, or this meditation thing, or there's so many other areas of medicine, like, my husband's a chiropractor. What he does works. There are diagnoses and situations where you can kind of, like, pull and pick and choose like what's the most appropriate thing. And I think learning what your toolbox is and what your things are, that's where you need to focus. And, you know, I don't think that there's only the right way, but there's a certain time and certain diagnosis. And like cancer, like we can talk about all the treatment plans, but stem cells can work for that. Like, do I think we can inject stem cells into somebody's like knee and it's going to regenerate like their complete arthritis? Like, probably not. Could it in the future? Maybe. So
Yeah, because
it's
I
a,
feel like a lot of the stem cells I see advertised like on Instagram and the things you just referenced, it's all about the shoulders, the knees, the hips, the joints.
so like
Um,
my reference to you would be like go to your local orthopedist who you trust and be like, what are your thoughts? Like, what's the research showing? What's the risk and benefit? Like, is this something
yeah.
worth trying? And like those are the conversations to be had. Don't I like I think I really love the barbell medicine guys. Have you Jen, you follow them, right? Do you?
Yeah, yeah, I know all about
Yeah.
them. Jordan,
Yeah. So one of the things I always appreciate about him is like he has like they have like firm beliefs, right? Like they look at evidence in medicine and research and they formulate an opinion and they think that this is, but they typically don't stand on anything with 100%. Like they don't, they're like, maybe my mind could be changed. Maybe something will develop and we could talk about like how this opinion may be different or how this research could show something else. And I think that's the right mindset to have. Like if you want to believe in XYZ something, like do your research for it, but don't ever think that your opinion is God. Like don't ever think that this is the only way that this will or won't work. And like if you put those blanketed white and black, yes or no, you're closing off like so much of just learning and education and mindset and research and growth.
but that doesn't work when people want a black and white answer.
I know. I know. And I think that that's well society as masses and I don't want to get too political but like that's the drive, right? You're either with us or against us. And I feel like we should just talk about being good humans and trying to propel like a positive society.
Yes, I concur. We can start bridging the gap through medicine.
We'll keep trying. I don't know if we have the answers, but
Well, one of the writers, I read this somewhere, that one of the writers of the show said that they described the show. They said it's a medical drama that had never been done before about critical issues plaguing our medical system and society at large, particularly in the aftermath of the COVID-19 pandemic. So, what does that mean? Like, how would you describe the medical world before the pandemic versus after? And obviously, everything you just talked about ties into the
yeah.
difference. But
Well,
from your view in the ER, what do you think is going on?
there's so many different categories to this, Jen. I think like one of them is just that mistrust, right? Like not believing, not taking at face value, and just being confrontational and challenging to your healthcare providers. Um, that wasn't there pre-COVID, not to the level that it is.
Hmm.
Um, substance abuse, alcohol, psychiatric disorders, homelessness, complex patient populations, those have all increased. That wasn't
So it was there before, but since
correct.
COVID, all of that's increased, is what you're
Yes.
saying.
Yes. The level of psychiatric evaluations that I have to do in the emergency department, I I don't want to misquote data that I haven't actually looked into, but like 25% more than pre-COVID. And I think that's
Wow.
me being generous. Um, and then, violence in the emergency room and um that's absolutely increased. Um, there's I just think it did such a good job of bringing out some of these political turmoils and some of the stresses that we're actually going through and like depicting it on the show so well. I'm very I'm proud of them for that. Like I am appreciative of that representation.
So interesting. Like,
And I think the other thing too would just be like even the fact that we're humans, right? That we're people too who have PTSD, who have anxiety, who have emotions. And, what we're going through is not like think about if I came into your work and just started throwing things and yelling and vomiting everywhere and
Oh,
Um,
it happens. It happens in our world
It
too.
depends on the show, but it happens quite a bit.
It
Yeah.
yeah,
depends on the show. But we've
but
seen
like
that.
even
We've seen
like
that all,
this the safety issue, like the idea that like every day there are patients and situations that you have to approach to hope that you don't get assaulted, right? Like, is that something that you're dealing with every day?
Yeah, I think that's, Sean was filming in jail for
Okay,
9
so
months. He was definitely
that I think is like a little special population.
Yeah.
But
I mean,
yes,
I wouldn't call us emergency room doctors, but
yeah,
we deal with every facet of life, and we're there to really kind of get to into some deep emotional material, and brings out all kinds of stuff with people. We've
think
seen a lot of crazy shit,
and I think
basically.
I hope to mean no like disrespect or anything diminishing what you guys do. I think I just think of like the general population and like what their careers are and like what they're doing day in, day out. And like outside of something catastrophic occurring, like most of them function in a blanket of safety.
For sure, for
And I
sure.
don't think
Yeah.
that we have that.
Yeah. Yeah.
There's always has to be like that heightened awareness. Um,
So in your view, I mean, you're dealing with the patient. You're dealing with, the problems at hand. But if you were to take a stab at like, what you establish what's changed, but like why? I mean, why like did the world just not go back to where it was after, the pandemic ended? What do you it seems that people are more agitated or something if all these things are happening in the ER.
I
I mean,
don't
that's
know.
indicative of something, right?
Yeah, I don't know what the trigger was. I mean, there was a loss of autonomy and rights, and I think society struggled with that, right? You were told what you could and couldn't do, more so based on freedom. So if you're no, you have to quarantine, you have to have 6 feet distance, whatever it was, that regulation people struggled with. Um, just like the general loss.
I just feel like, social media, like, really has played a huge piece in it all, really, in my opinion. Like, especially like just like everybody's so sensitive politically and such. It's like, I don't know, social media is bad news.
I kind of think social media it could be good, right? But it's not regulated. So it's
Yeah.
hard to have it only be positive. And you're right. I think that there was like so many opinions and like decisiveness of like right and wrong. And
Yeah.
instead of like person to person, human to human contact and debate or discussion, it's right, wrong, and I'm behind a computer screen and you can't even see me, and I'm gonna just say all the inflammatory things that I can, and there's no regulation to it, and I have my freedom of speech. And sometimes that's dangerous.
Yep. I think, like, I don't know a lot about the United Healthcare case, the CEO case, but to me, it just seems like that was probably triggered from all of this, right? The social media, the inflammatory, the all of that.
There's a lot of concern about it, and what's the saying? With great power comes great
Great
risk.
responsibility.
Yeah, great responsibility. With great power comes
Spider-Man. Isn't that
responsibility.
Spider-Man?
I'm pretty sure it was someone before him. I feel terrible that I don't remember who it was.
That's funny. That's
Whether it
funny.
was like Henry Ford or some, I don't know. I must now I have to look that up.
Well,
So
Spider-Man definitely said
he's
that.
no, he
Spider-Man
portrayed
got Spider-Man got me the other day.
what?
Oh. Oh,
That's a
what?
that's a yeah. It's like four
Doctor
little
on the spot.
bites. It's better today.
Whoa.
Did you get a
Better
brown
today.
recluse?
I don't know what it
Whoa.
was, but it ate me up, and it feels better today. But speaking of
That does
Spider-Man,
not look good. Doctor
that's
on the spot. What did
this
he
is
say?
like 10 times better than it was. It was like
Oh
my
my
whole
God.
I
arm was
mean,
like,
you're gonna live. I do know
You're
that.
yeah, let's hope so.
I think you'll be all right.
Oh
Plus,
my
you're way
God.
out of the window for any kind of anti-venom. So
Yeah. But speaking of
Oh
Spider-Man,
boy.
that was my Spider-Man moment, man.
rough. I love when
Yeah.
patients will bring in whatever creature it is that got them. Like I'm like, I'm not,
Ah,
what am I going to do with this? Like, here's the snake, or here's the spider, or, you know,
Yeah.
the bee. It's like, well, glad you got him, but what,
You're going to
I'm not
examine
sending
him
this
just
to
in
the
case
lab.
he's got a disease. But actually, speaking of the pit, speaking of animals, the pit, the rats. Have you
Ew,
ever
I've
had anything like
never,
that go down?
never. Gross. I have had other animals of like, I had a psych patient who was homeless, and she brought her cat in. And so, you know, we just like were bleeding hearts. So we one of the like chargers just went out and got like a litter box and like cat food, and we just like had a therapy cat for a week.
Wow,
Like,
wow.
you know, I've had dogs come in, which I'm a huge dog. I love my animals. So like, but if you have someone that was in the car with you and you get in a car accident and then they bring in Fluffy, and I'm like, no, we're not
Yeah,
kicking Fluffy out. They're fine. As long as they're not aggressive to anybody, I'm not throwing your dog out of the emergency room.
yeah,
I'm not inviting everyone to bring their
I
animal.
was just gonna say. I
Doctor
was
said he
gonna
was
say.
fine. Not, don't quote me, please, on that one. But there have been situations where we have had animals in the emergency department. Yes.
I just want to rewind the time really fast. If you're back in Utah right now, Noah Wiley, the writers of the show, creators of the show, whoever he was with, it's lunchtime at this convention. It's all hypothetical for everybody watching. And they sit down at your table and they say, what do you want to see in season 2? What are you giving us for season 2? What is season 2 looking like? What stories should we have? What is Dr. Julie giving them?
I mean,
Yeah, good
I was going to
question.
tease, like, I don't know how many other procedures they're going to, you know, there's only so many of those like heroic big procedures. So they're going to have to get pretty creative with that. You know, I don't know. The stuff, and what I'm thinking, guys, is really sad. I don't know if you want to hear it. Like, one of the things I've been through personally is a young lady who was we thought further advanced in her pregnancy than she was. And she was unfortunately a drug addict, and came in as a cardiac arrest, had used, and her heart had stopped, and they were doing CPR. And I doing everything I can to treat her and resuscitate her and bring her back, and it's not looking good. And I put the ultrasound on her abdomen, and I see that her baby has a heartbeat. And it's a slow heartbeat, but it's there. And I look at the nurse who's working with me, and she's like, do it. And she read my mind and knew what I was thinking. And there's something called a perimortem C-section. And that is where you essentially perform a crash C-section on a deceased mom in order to attempt to save the baby. And not many ER docs have done that procedure, but I have. Um,
Wow.
yeah, it was pretty gut wrenching and sad.
Did they?
Our baby didn't make it. We had heard, so viability for most infants should be like 24 weeks is usually when we can use science and things to support that infant that didn't reach term. And this infant, unfortunately, was probably about 19 weeks. So they were just
Oh,
way too premature. We had been told by EMS they thought she was 26 weeks. So there was definitely that chance there. You know, and I don't have any regrets on performing the procedure because now I know I can do it, right? Like, one of the hardest
yeah.
things of emergency medicine is giving yourself permission to cut, giving yourself permission to do that scary thing. You know, I'd like to see the pit put some of that into it because, man, all their residents and attendings have no fear. They just jumped into every procedure, you know, just without even a hesitation. And I don't know that that's really how it feels all the time.
Oh, yeah. How
Um,
does it feel?
well, there's just like a not a hesitation, but like a debate. Like, an example, I had a woman this week who came in severe respiratory distress, probably needs a breathing tube, right? But she's got a lot of risk factors. And sometimes when you put people on a ventilator, they don't just come right off. Like, their body doesn't have the support that it can do on its own. If you have an illness or a treatable condition that will lessen whatever their like extremis is, then you do what you have to do. But sometimes people end up on ventilators for a really prolonged time. So, you know, she came in, I had a respiratory therapist with me, a PGY2 and R2, and myself and a bunch of nurses. And I said, all right, let's just try some medical management here. So we were doing, you know, our BiPAP and our magnesium and our Solumet and our nebs. And trying everything we could to like bring her and support her. And we got her so much more comfortable. We gave her the best shot. And then I got her blood gas. And actually they were teasing me because this was probably the first time in my career I've been like exactly right on. We like to predict numbers. It's just something we do. So I'm like, all right, this patient's blood gas, she's gonna have a pH of 7 and a CO2 of 100. And her pH was 7.060 and her CO2 was 100.6. Just to give reference, guys, like you should be alive at a 735 to a 745. Should it be 7 even is like not compatible with life. So we're like, all right, let's put the breathing tube in and do it. But like, we didn't just like see her throw the breathing tube in and go. Like we took a little more time and like did a little more assessment and a little more resuscitation to try to see if we could like save her from needing that procedure. And then we got her to a much more comfortable state. But looking at the blood gas, I was like, all right, this is inevitable. I'd like to see some more cases too. Like I said, that perimortem C-section might be something of significant drama. Like let them pull in some more, go back to the violence, go back to the weights, go back to the social constraints that we're having, go back to the physician shortages. That's a huge one. We don't have radiologists, so it takes forever to get reads on our advanced imaging. We don't have specialists that people need. We're losing out on physician. Like it's become so much more thankless. And frankly, between the risk of being sued and malpractice and all the costs that it takes to get to be an attending physician, like it's not this like hugely lucrative career that I think is like falsely put out there. You're not just sitting back in your Rolls Royce and chilling. Like that's not the life we live. Um,
Yeah.
and so I think putting some of that in and the dynamics of like the challenges to get there and that it's really hard to work when you're short staffed and you don't have people in the positions that they need to be in. So, and that was another thing that like he had brought out, which I think we've touched on, was like he was hoping that this would, ignite a fire for people to want to pursue this career because it is beautiful, but we've been through a lot, as we've talked
Yeah.
about.
Yeah, I
I
find that
predict Go
TV
ahead.
shows like this are great for recruiting. I feel like the law enforcement shows that we Jen and I have worked on and such. We were always told by the agencies the reason they do it is the hope of recruitment and
Yeah,
such. And
I got in not an argument, but a healthy debate with a friend, colleague. He owns a locums company, and I don't know if you guys know what those are, but they're physicians that get hired to travel, and they just fill in where there's gaps, where there are physician shortages. And we were talking, and he's like, "I think the pit was kind of a waste. Like, what do we need this for?" And I was like, "I adamantly disagree with you." I'm like, if it makes a 5% increase in people wanting to have a desire to go into this field, it's grossly successful to me. If it gives any light to the mainstream public about what we're going through and what it's like on this side, and they can have even some empathy for us, then it's successful. If it gives any political backing to get us support, whether it's from our organizations or politically or society's health in general, it's a huge success. So um, I
It
think it
also
hit on all of
teaches the
those.
patient how to not be an asshole patient.
I hope so.
hopefully, yeah, hopefully, yeah.
I
Because
mean,
when
there's
you're like,
always
"I would
going to
never
be
act like
one.
that." You're
Yeah.
like, "I would never act like that in the emergency room," until you're
Yeah.
there for 8 hours.
People can get to a breaking point, and I think that's when I was talking about what I've been through on my own personal journey, like that aids in like why, like if somebody's acting a total fool, like which is gets annoying, but they always come and get me because they're like, all right, Cullen can talk them down. Um, but it's just like literally like acknowledging whatever it is are they angry? Are they anxious? Are they sad? Like acknowledging whatever that emotion is and then being like, how did we get here? And like, how do we move on from here? Like, what is it that you need from me that we're not giving you? And I don't know. I think that again, it like goes back to like just don't be a total asshole just to be an asshole, but like there you can get to a breaking point, and I can have some understanding for that. So
Sure.
we and the other thing about us too is like we always want to do better. Um there not nobody that's in the field that we're in is going and being like, I hope I'm just mediocre today.
Yeah.
Like that's not the drive or the desire, but it's hard to stay 10 out of 10 all the time.
Yeah.
Indeed, that's no joke. I bet there'll be, like, some sort of plane crash situation. Like, if they have one big
Yeah. They
if
could
they had,
have.
like, a shootout in the first
Yeah.
one.
I mean, the other thing you think about, we have active shooters, bioterrorism. So, like chemical warfare, that could be something that they would possibly touch on. Um, I think of some of the other big things that they could have. I
Protests,
mean, bombings.
violent protests or something.
Yeah, yeah. Um, I mean, assassinations.
Yeah. Yeah.
So,
Oh,
there's.
What about
yeah.
you're at that same table? You're at that same table back in Utah, and they're saying, Dr. Julie, we're going to give you a role this season. What do you want to play?
I want to be Dr. Robbie's counterpart.
Okay. Okay.
Like, I'm not gonna backtrack, right? And it's funny because I've explained to my husband about, like, the multitasking, and you're like, "All right, went to this room, stabilize that patient, next one. Go to that room, stabilize that patient, next one. All right, we gotta stay in here, do this procedure, and then we'll go to the next one." And, like, sort of this, like, balancing act where you're just constantly moving through the shift. That's what I do, and it sort of is an art. I think that Dr. Robbie did a good job of, like, representing how that feels while you're also trying to teach and take care of your own patients and do some administrative things and coach some of your other peers. So yeah, I would, and looking at that too, now granted, I think it's only one pod, but like you need more than one attending on a shift for that kind of hospital with that kind of acuity. Like it shouldn't just be like only him with that many beds.
Yeah. Yeah.
So, I mean, I guess I'd like Noah Wiley, but like I give him the boot and be like, let me show you how it's done.
You wouldn't want to stretch your chops and show your chops and like play like the homeless heroin addict coming in and all
Oh,
tweaking
that,
out.
yeah.
And,
God, I didn't even think about myself as like that kind of an extra. Oh man.
uh,
Those options are endless. So yeah, I could be a psych patient for sure.
okay.
Definitely a difficult psych patient. They actually, speaking of that, they talked about props in the show. And do you remember when they make the poor medical student go in and give the like sedation shot of medication to the psych patient and he gets peed all over?
Yes, yeah, yeah, yeah.
So they're like advertising the equipment that they use that like is something you can get on Amazon that like you could put water in or whatever, but it can be used absolutely to stimulate to emulate someone being urinated on, which happens all the time. So I thought it was really funny that they put that in there.
That's funny.
Um,
So,
Go ahead.
what do you think how would you describe well, yeah, how would you describe, what kind of person thrives in an ER environment? Like, if you were to describe the perfect character traits
I
of
mean,
someone who thrives in the ER, like
there are
but
there are personality tests that you can take that'll tell you like what specialty you should go into.
oh, wow.
ER tends to be, this is going to surprise you, but energetic. Kind of a little ADHD. Like we can't just focus on one thing. We need lots of things going on. Usually good communicators, somebody that can be pretty clear, decisiveness. So like we talked about that permission to act. Like you have to be able to know, okay, this is the next step and this is what we're going to do, even if it's scary. Um, we're also like facilitators. So the same way that you saw on the show where he's talking to his hospital administrator and then he's talking to the patients and he's talking to his staff and he's talking to specialists. You have to be able to communicate through all of those different avenues and personality types. Usually extroverts tend to do better in the emergency room. And then normally it's somebody that's pretty good with their hands. Someone that, like wants to be doing procedures and be hands-on. And usually they're people who genuinely like people and like interactions because that, like I said, we're making that connection and that bond in a short time frame. That's usually probably the worst moment for whoever that patient is or their family member. So I think that's another really key thing.
So one of the characters, I think it's Bryan Cranston's daughter, Dr. Mel, she's, like, presented as neurodivergent. Is that normal, or is that
That's
a
like the atypical for ER. But I loved it. I loved her character. her ability to connect with other patients. I thought she just represented it so well. Um, I can think, and they're not as much ER, but I can think of some of my friends that would tease themselves that they're like on the spectrum. They're like, I don't know where on there, but I know I am. Like
Just
I
some
had,
spectrum.
yeah, I had a doc come in, and he's a specialist and a good friend, and the wife of this patient's there, and the patient's dying. He's got a laryngeal cancer, and he's talking about options because he's getting kind of near the end of his course, and we're running out of things that we can do. And so he's trying to say, hey, these are some options. And the wife keeps interrupting, and she keeps interrupting, and he stops and he goes, you're not dying. I'm not talking to you. Sit down. Shut up. And she just kind of like plops down, and we walk out of the room, and I'm like, you know, you weren't wrong, but like the delivery, I would have done it differently. My approach would have, and so he just starts laughing, and he was like, it's not my fault. I'm on the spectrum.
I'm on the spectrum. I love that as an excuse. I'm on this spectrum,
Well,
so I can talk to you like I want to.
no, I don't know.
I'm just kidding. I'm kidding.
Yeah, no, I think some of the people, the social skills can be a challenge, right? And I think that that's part of what we were potentially
Sure.
seeing for her. But being able to like coach through that and have the medical knowledge, like, I mean, I know it's just a character, but I'm like, she's gonna be a badass ER doc one day.
I loved the character because
Yeah.
she was so awkward, but like very good at what she does, but awkward with the people. And I think I don't know, it
As
seemed like an accurate person. I just didn't know if that was accurate in the
it
ER.
is. As a medical director, I do a lot of the onboarding and a lot of the coaching of our younger physicians, and I mean, essentially everybody that's um, under my helm. But having to like navigate different personalities and try to, I don't know, like soften things, but people like what they like. And so if there's something that's like different from what they think is what they want or what they like, having to talk them into like why these differences are better or what you can learn from this other person or personality. I think trying to like dive into that and find all of the good in that person, like whatever their qualities are that make them unique and better, and like bring that forward. Right. And then just if there's a barrier, like figuring out how we can make that barrier as small as possible.
That makes sense. Yeah, I mean, we build teams like that on our crews too, because you're relating with so many different types of people. You need different types of perspectives to be able to connect with people in
Mm.
particular ways sometimes.
Like I look at metrics, and one of the things that I'll see is, I have a doc who's super personable, right? And he just makes really good connections with all his patients. He's great patient satisfaction scores. He's probably the slowest doc I have, right? So we look at metrics, and we look at patients per hour, and we pay attention to that, and it does matter for us. And we want to, we want to be efficient also, right? It's that's a key thing, and that's what patients want too. But the people who are super efficient, who just plow through and like can see 2.5 patients an hour, like the patients tend to be a little less satisfied. They're not sitting as much, they're not explaining as much. So you kind of have to find that beautiful balance. And like that's an art, and it's something that we try to teach and coach.
That was a theme in the show.
Absolutely. There was the one doc, right? She cares too much, and she's always,
Yeah.
I've had those. And I let myself get into like one thing a day. Like I give myself one patient of like, okay, the system may have failed you. Like, what can I do possibly today that can be different than what is normal for you? And those tend to be really rewarding experiences. They're emotionally exhausting though. And so I can see, we talk about burnout, right? I can see why docs are like, I'm not having the heart to heart with this drug addict again. They overdosed again. I'm not going to sit and try to talk them into going to rehab. We did it 17 times this past month. Like they don't get it. Why do I spend the extra 10 minutes with them? And so I try to like pick one a day, or like I go back to that bottom line of like, this is a human. Like this is someone's brother, son, husband, father, whatever. And um try to take that like extra minute and say, maybe I'll make a difference today. And that's something they could potentially show a little more on the show too, of just that level of emotional exhaustion that comes with it.
Does does the pit work as well? Jen and I, we're non-scripted producers. Does the pit work as a reality TV show? We bring our cameras in and we just follow you around for a day. Are we doing Delaware 911?
I would love that.
I do too. I
Actually,
love that.
yeah, when I was a resident, Oprah had come in and wanted to do a special on female emergency residents, and then she wanted to follow these women um, around, and we did casting calls. And like I was asked to be part of this, like they took your CV and then they did headshots and they brought you in for an interview. And we got really far in it. And then our organization said no. And they were like, we're not doing it. So I think the biggest reason, and shows have done it before, but the huge challenge is HIPAA and patient privacy,
Yeah.
right? Like,
Yeah.
how do you get consent? How do you, like, you can see the extraordinary vulnerability that is real life emergency medicine. So, like, how we would get people to be able to agree to have that
You would
exposed.
just yeah, the release
Yeah,
system would you'd
that's,
have to yeah, that's
You'd have to start with a
intense.
blur and then hope to get
yeah, yeah, yeah.
to remove the
But
blur, I think,
I would love
Well,
it.
the
I would love to have my organization agree.
Yeah.
I
Yeah.
volunteer as tribute.
Yeah. Yeah.
okay, HBO, we've got a show for you. It's
Yes.
called Dr. Jules.
Come follow and see all of the crazy things that we do and experience every day.
I love that. I spent a few months in an animal ER clinic in Portland, Oregon, and it was fascinating.
Yeah. I think
I
that
I
would be
loved it. I
something.
had no idea what those doctors go through. You know, I
Yeah.
was thinking, "Oh, great, we're gonna be working with animals. I love working with animals.
I
This is gonna
already
be
know where this
such
is
a great
going.
show." And the first day we filmed, the doctors had to put down like 10 dogs for various reasons, and I went home and had to have a glass of wine because it was so stressful. I had no idea how hard that was, how it was awful.
As you started, I anticipated that that's where you were going with it.
Oh,
I,
yeah. I had no idea. I had no
yeah.
idea that it was like that.
I love that you guys put yourself out there too and see so many different perspectives and careers, like, because you would have no idea what people go through until you actually live it with them. And I guess that ties back into like why the pit was great because it gives this real life perspective of like the other side and what we're actually doing.
I love it. Well
Yeah, but
said.
yeah. Yeah.
Well,
Yeah.
Julie, it's been such a pleasure talking to you. I
Likewise.
I love getting to know the real scoop and I certainly enjoyed the show and it felt like a very long day. Like the 15 hours just seemed insane. So I'm glad you said that in real life it would take about 10 years to have all those experiences.
Yes. I would
Um,
say we could have a third of them in a day. That would be my average guess of like how much stress and acuity they see.
that's pretty high though
Yeah.
still.
Yeah.
Yeah, I mean, and it depends on the day too, and the shop where you're at.
Oh,
What's the
actually I have one
population
more
of your
oh,
community?
So it just depends what site you're at. So, one of them is a more urban area knife and gun club. Like we call it like a mini Delphia because it's kind of mirrors Philly, but substance abuse, homeless population, alcoholics, knife and gun club. Um, and then the other's a little bit more rural country. And actually, we have migrant workers and immigrants and Amish population and more farming equipment. So you can get completely different trauma, but the pathology is insane. And like the level of diagnoses. I tease because when I first signed on, my mentor, Kelly Abrasha, who I loved, and she was the previous chair and director, she recruited me and was why I came and have been where I've been. But she said, "You're never going to be bored. I know you trained in downtown Philly, like the thicket of it all, but like we just see acuity and insane diagnoses, and you're just going to be always learning and experiencing. And I sort of remember feeling like I wanted to like dismiss it a little bit, like, oh, okay, sure. And, it was really cool at that ASAP conference. I ran into an old scribe. So the scribes do the medical charting in the ER. And she has now gone to medical school and is applying for the match to do emergency medicine residency. And her and I were talking, and it was really nice. She was talking about some of like how I influenced her positively, but we mentioned the acuity and kind of the pathology that we see. And she says, I scribed for you in little old Delaware, and then I've traveled, for all of these different rotations, and I worked in other hospitals, and then I had different experiences through medical school. And like sometimes I think back and I'm like, man, I saw the coolest stuff I ever saw back in Delaware. And I
Wow.
just thought that was hilarious. And I'm like, thank you for validating that.
You said Amish there, and that, and you do have a high population with that. If you have somebody from a religion that comes in, and maybe they don't want, or they don't, their beliefs don't allow them to have certain types of treatment.
Mhm.
Do you come across that? Is that something you come across, like where you
Yeah,
should, or I mean, how do you handle that? Like,
very case by case. The best thing you can do is shared medical decision making and informed consent. I've had kids is a whole other story, but I've had
yeah,
adults who are of sound mind who are actively bleeding out, who say Jehovah's Witness that don't want to receive blood transfusions. And, um, the religious implications of that are significant for them, including their afterlife. And, you know, there has to be a respect for that. So, uh, if if they truly understand what they're risking, we'll do everything we can to not try to like break that boundary for them. But they make that decision. And there has to be a respect of every culture. And we are trained and taught to learn a lot of different cultural differences so that we're able to better treat these patients. And I think I'm really appreciative of that. There's always learning on the fly. But yeah, no, we try to respect every individual's personal perspective. I had a guy, and I think because of also what I've been through, I'm a little more cowboy, a little more cavalier. So, I have a patient. I'm like, yeah, you should probably stay in the hospital. And they're like, no, I want to go home. Say it's a cancer patient who's nearing the end of their life and they're pretty ill, but they're not on hospice. And they are sick, but they just want to be at home. And say they have 100 days left. And if I bring them in the hospital, they're going to be there for 30 days. And so I have no problem sitting down and laying it out and being like, hey, look, you could get much worse. Like we could keep you here and treat you and maybe you'll do better. You could go home and do okay, but I have concern and I think you should stay in the hospital. If they're like, no, I want to be at home, I say, okay, I'll give you everything I can to hope that you're successful and as healthy as you can be. Um, but I just think you have to meet people where they're at.
yeah, yeah,
That's a that's amazing.
yeah,
And
yeah.
what's interesting about your career is you went from nursing to, ER doc to medical director. Like that's not a typical path, right? Isn't nursing or being a doctor one of two different tracks?
Majority of the time, yes. There are several docs that were nurses and they get into the field and then they decide, okay, no, I want to change my career projection. Um, Nursing is amazing and they have such a strong contribution to all things medicine. For me, I wanted to trust myself over anyone else. I wanted to be the decision maker. What's the meme? I'm the decider. I decide. I think it's a
I don't
I
know.
think it's a quote from the show New Girl. Anyway, and I can be said, but I wanted to know that I had the knowledge and the understanding and the responsibility to like be the one that's making the calls. And know that I would deal with the positives or the negatives from that, whether you're right or you're wrong. I liked being hands-on and being the one that was doing the resuscitation and kind of being the leader. And those aspects with like what you're able to do clinically, it just made more sense for me to be a doctor and continue on. And I will say, I think being a nurse made me a better doctor. I still go get patients blankets. Like if we have somebody who's been incontinent and I'm not slammed with 15 people waiting to see me and it's just one nurse, I'm going to help clean up that patient. And I think that's also how I've become a medical director, right? Is like that there there's no service below me. There's nothing that I can't do for someone else. Um, and I think that that's a really important thing to remember. While there's like a hierarchy and you train and you continue to climb a ladder, like there's no rung below that that I can't jump back to and like be part of a team for.
Yeah.
That's
Yeah.
amazing.
And you are right. It is. I am the decider. I just looked it up.
Did you? Yeah.
Yeah. Yeah. The quote.
It's
Yeah.
pretty
Yeah.
it's pretty funny. There's one meme that my surgeon friend sent me, and I forget who all the characters are in the meme, but like the surgeon is the one that's like, I'm the decider, like I'm deciding and being very howdy. And I think that fits on like the suspected personalities that you align and typically assume are with that position.
There has to be like some Myers-Briggs test that
Oh,
helps you
there are.
calculate, right? What's
Ab-
your Myers-Briggs?
I so
You
long
don't
ago,
remember? Oh,
don't.
okay.
I definitely should redo it, but I don't remember.
I think those are fun.
Yeah, I'm into self-reflection and like learning about what makes me tick and react and like just like your emotional intelligence. Like I think we can always be better and do better. So
What about fentanyl? Are you seeing that in the ER? That was a pretty big
yeah,
theme.
every day. Every day. Their fentanyl is now being cut with different things. One of the big ones been xylazine. And actually it's not the overdoses that have been so terrible, it's the withdrawal. Very sick, ICU level withdrawals. And the thing I love about my organization is, and even just our, it's nice being on the little state, but like we have a task committee that is working on protocols to try to treat these patients better. Again, always learning, always trying to do better. So we created treatment plan protocols and medications to administer and kind of what you need to investigate and look for and how to treat them, so that we can do better for it. But it is, people talk about the wait times. Well, I had to admit 10 people who are having opioid withdrawal in an attempt to save their lives. So we've run out of beds, like, and maybe there's a faint exaggeration there, but it's every single shift I'm seeing it. And whether it's an overdose or a withdrawal or somebody who has some form of an addiction, it's every single shift we're dealing with that.
Yeah. That stuff's brutal. It's really
It is,
something.
it's scary, and it will absolutely take away everyone their entire life of that patient.
Yeah.
Um, and you can see what were societal successful humans that deteriorate.
Yeah.
It sometimes looks scarier than cancer.
Yeah. I mean, to me, they're zombies. That is the
Oh
zombie
yeah,
apocalypse. You know?
it's
Well, we saw that in jail.
I
All
There
the
bet.
was a lot
time.
of
Yeah.
there was a lot of that in jail.
Well, it's a double-edged sword, right? So you're doing that, you're making poor decisions, you're getting in trouble, you're going to jail, you're continuing to not have your addiction treated appropriately while you're in jail. Potentially you get out. There's likely untreated underlying problems and the cycle continues.
Yeah. Yeah. We were seeing Narcans. And for me, that was kind of far out, but we were seeing the Narcan get used nightly. Every
Oh
single
yeah,
night.
every day. We have
Yeah.
kits that we give out in the emergency room. Um, because like, God forbid, like we don't want these humans to have their lives cut short because of this disease that they have.
Yeah.
Um, and actually, if the pit gives any like societal insight to this and maybe a little empathy, then I think there's another success that it had.
Right. So we've solved the season 2 puzzle, and we have a nonfiction version of the pit coming to HBS.
Be so
I-
excited to hear about this.
we just have to get all over all the hurdles of HIPAA and signing
Yeah, my
releases, and
my hospital administration is, I'm gonna have to get a lot of buy-in from them. Luckily, we're all friends, so hopefully they'll see all the positives and none of the negatives.
we know what we could do is just mount the place with GoPros, just rig it with
Yeah,
hidden cams and just let it roll.
that would be enlightening and eye-opening. And slightly terrifying, potentially.
Yeah, you can
Yeah.
just have wear a GoPro headlight, one of those ones like on your and just walk around with
Yes,
it.
yes. Would love that.
Uh,
Although the angles and some of the things I see. So, like, I don't know if I should, like, on the record or off the record, but Zach had this, like, epiphany of, we do a lot of rectal and vaginal exams and, private things, and I was like, "Yo, a rectal exam's the ER handshake." And he was like, "Wait, you do that? Like, you have to insert your finger into someone's rectum?" And I'm like, "Yeah, probably every day." And he's like, "Why?" And I'm like, "Well, a lot of it's like if there is a cult bleeding or if someone's anemic and we don't know why, or if they're themselves complaining of rectal pain or rectal bleeding, like we do a physical exam. Like it's part of what we have to do." And he was just like, it's not all pretty. A lot of what we do is not glorified or majestic.
An ER handshake. I would love to see that
And
that line in season 2, the ER handshake.
if they do, I hope I get you know, some profit from that. But no, the other thing that I'll say is, this isn't fun for me either. And I'm like, if it wasn't medically necessary or important, if it didn't help us take care of you, like I would not just subject you to this. Like there is a reason to why. And then usually I get a couple laughs from the patients about the situation we're in. And of course, if someone's going to adamantly refuse, like just document it. Okay. That's not what I'm going to lay on the iron cross and argue with you about.
Oh my gosh. Well, Julie, this has been incredible. I really enjoyed talking to you, and we
Yeah.
appreciate your time. You're a busy lady working
Yeah.
10-hour shifts all the time.
I'm doing 5 out of 7 this week. So
Wow.
it's a heavy, heavy clinical week, but still feeling like I've got the energy and happy to see what the next shift brings on. So,
Julie,
and I
thank you.
appreciate you guys. And I think that, it's cool what you're doing and bringing even more attention to just the show and kind of everything that we're going against right now.
But we're here to entertain, and we're also here to connect the dots about what's going on in life. I think the story transcends beyond entertainment.
Putting out some truth bombs.
That's the plan.
Yeah. All
Awesome.
right. Well,
Well,
thank
thank
you
you
so
guys.
much. And we will let you know when we launch.
Sounds great. I'm excited to see it.
Thank you.
Awesome.
No problem, guys.
All
Take
right, bye-bye.
care.
Bye.
Bye.